We also continue now this morning's discussion on reforming health care. Later this week, President Obama will hold his second town hall-style meeting on the subject. And Jean Mitchell is an economist and also professor in the Georgetown Public Policy Institute. And she comes to us now from our Washington newsroom. Professor, thanks so much for joining us.
Thank you for having me.
Well, we just listed from our reporters, essentially all the problems right now that are being faced with healthcare reform. I mean, singularly, though, what do you think is the biggest hurdle to reforming healthcare?
Well, there's two big hurdles to reforming healthcare. The one that Congress is dealing with right now is expanding coverage or covering the uninsured and people who are underinsured. The much bigger problem, though, is controlling costs, and that is a very, very difficult issue, and Congress has spent very little attention on the cost control.
Why is it so hard? Why is it so hard to control costs?
Well, the reason it's really difficult to control costs is because a dollar spent on any kind of healthcare services is equivalent to a dollar of income for any provider. So if we're going to really be able to rein in costs, all the providers are going to have to take a cut. The durable medical equipment suppliers, the hospitals, the physicians, the home health agencies. And it's very difficult to tell people that, you know what, you're going to make less money. Nobody likes to hear that.
Well, exactly. Nobody likes to hear that. How likely would they do that? How likely could we force that issue with them?
Well, I think that the current trajectory is unsustainable. I mean, if we do not take drastic measures to reform the reimbursement system. The way physicians are paid, the way home health agencies are paid, durable medical equipment suppliers, it's what we call an administered price fee-for-service system. So the bottom line is the more you do, the more money you make. And the administered price system, Medicare and many of the insurers are overpaying for many procedures and services. So let me just give you an example. A frequent advertisement on TV is for scooter wheelchairs, and they advertise that Medicare will pay for these scooter wheelchairs. Right. Well, Medicare pays a little over $4,000 per scooter wheelchair. If you went on the internet, you could buy the same scooter wheelchair for $2,100.
Really?
So Medicare is paying $1,900 in excess of what it should be. Well, when the Center for Medicare and Medicaid Services tried to implement competitive bidding a couple of months ago for durable medical equipment, the manufacturers just went crazy. They lobbied Congress and CMS backed off. So, what you've got to think about is that every healthcare provider belongs to an organization that is lobbying Congress. Right. And, and so Congress gets to CMS and says, look, you can't do that.
Okay, then you outlined some very compelling arguments as to why, obviously, we need to revamp this healthcare system. But does the legislation going through right now and being proposed, does any of that address what you just talked about?
Very little. I mean, they've talked about cutting payments to the Medicare Advantage plans, which is a good idea because they overpay them compared to what people in fee-for-service are paid by about 14%. They've talked about bundling the hospital stay in with the post-acute care, which is a good idea. But they have done nothing to deal with this fee-for-service system, which gives physicians and all these other providers the incentive to do more.
Professor, thanks so much. We're out of time. That was Jean Mitchell from Georgetown University.